Hey everyone. Irritable bowel syndrome is probably one of the more common disorders we talk about and hear about because it's estimated to affect about 20% of the population. Over the past few years, there have been some studies finding a correlation between having irritable bowel syndrome and infertility. So they're kind of worlds apart. We're looking at, how two different organs and disease processes in different organs can affect each other. And because it's such a common condition, I think it's really important to look at it a closer lens. If one out of every five patients we see has IBS, um, and they're coming for infertility, are there common factors or are there factors from the IBS that can worsen infertility or reduce treatment outcomes for fertility treatments? When we looked into this a bit deeper, first of all, it's very important to mention that we're looking at a correlation, not a causation. So it's not that we know for sure IBS itself causes infertility, but we see a correlation that patients who have IBS may be at a higher risk of having infertility issues as well. And there can be many common factors present that can both increase the risk or symptoms of IBS as well as infertility. So it's not clear if it's the IBS itself that's causing infertility or maybe contributing to infertility, or whether there's another factor present that's affecting both of them. For example, some of those factors may be something like a poor diet. So with IBS, we can often see poor quality diet. So we have imbalanced macronutrients, lower amounts of micronutrients, and these factors have been shown to potentially affect fertility outcomes as well. Having an unhealthy diet, poor antioxidant status, and micronutrient absorption can also affect infertility. With IBS, if we're having increased alcohol intake, tobacco use, a sedentary lifestyle with little to no physical activity, these are all factors that can worsen IBS as well. They've been associated with worsening fertility treatment outcomes and potentially decreasing the chances of conception and success. So, in a practical sense, I don't really think it makes much of a difference for us because even if there is a common underlying factor that's affecting or worsening IBS or affecting fertility or both, the way we would approach it looks the same because the same things that are lifestyle and dietary changes and supplement changes we would make to support IBS have independently been shown to support potentially better outcomes with fertility treatment. So when we're looking at IBS, we're helping patients to address their digestive issues, improve the digestive issues, which in its own should be supporting overall health as well. Because with IBS, we can have decreased nutrient absorption, and with decreased nutrient and micronutrient absorption, it can affect impact the health of many different processes and metabolic functions and reproductive health as well. So just having decreased, CoQ10, vitamin C absorption, some of these important micronutrients and antioxidants, we know we can see an increase in damage to the sperm cells, reduction in egg quality. So the use of these micronutrients and absorbing it well from our diet has a very important practical translation to improving and supporting reproductive health as well. So we're treating the IBS, to improve quality of life. Nobody wants to, if they can, have to live with chronic constipation or diarrhea or alternating. So improving quality of life, improving digestive health, and those lifestyle factors usually help with fertility anyway. So we're treating kind of two conditions with, one simple change. But in addition to that, these new studies, what they're looking at is something called oxidative stress. And this is a common theme. If you've been watching our videos or our research posts, oxidative stress is something that we keep bringing up over and over again. And it's very important to mention, fertility is one of those systems of the body that is very sensitive to the health of other parts of the body. So, instead of looking at the body as separate organs and separate functioning systems, we're trying to look at the body as one cohesive, holistic unit. So if one thing is, out of order or not working very well, it affects the health of other organs and other healthy functions as well, such as reproductive health that we keep referring to. So when we have increased oxidative stress can result from so many different factors, but it's been suggested in multiple studies to be that one bridge that links poor health in another part of the body to poor health for reproductive health, or reduced reproductive health. So increased oxidative stress is very toxic for fertility. It's been shown to reduce the quality and health of sperm cells. It's been suggested to reduce the quality and health of egg and follicles, and reduced quality of these gametes, eggs and sperm cells. It's the equation, or the consequence of that is poor quality embryos. And we have lower quality embryos, the chances of those embryos leading to implantation and leading to healthy pregnancy also go down. So we get these fragmented embryos, lower quality, issues with the cell membrane or cell wall. So they're less likely to fertilize, less likely to implant, less likely to lead to healthy pregnancy. So improving the quality, integrity, the DNA integrity of the egg cell and sperm cell is of vital importance, especially in today's day and age where oxidative stress is going up and up with chemical exposure, air pollutants, sedentary lifestyle, poor quality diets. All these factors are increasing our oxidative stress, and our body has a very specific system to deal with this oxidative stress, and it's called the total antioxidant capacity of the body. So we have a certain capacity to deal with this oxidative stress in the blood and in the tissues. And by dealing with this oxidative stress, we decrease their harm to the cells, to the DNA. But when we have more oxidative stress than our antioxidant system can handle, that's where we start to see this damage persist. So a lot of these factors like IBS, for example, that we're coming back to now, which we're focusing on in this video, they've been suggested to potentially on their own impact fertility as well as many other conditions. But IBS specifically can impact fertility by increasing the amount of oxidative stress in the body. And that oxidative stress, in order to deal with it, we have two options. One is we can improve our antioxidant capacity, so we can improve our body's ability to meet this chemical stress, and to reduce its negative impact on the body. And option two is to decrease the amount of oxidative stress in the body to start with. So we decrease and we start to remove the factors that increase our oxidative stress right from the start. So decreasing smoking, decreasing cannabis use, decreasing or improving the quality of our diets, reducing symptoms of and severity of things like IBS. So if we can reduce our oxidative stress and improve our ability to deal with these reactive oxygen species, then we can potentially lower the amount of these reactive oxygen species in the body, overall. And by reducing them, we can reduce the harm they have on our gametes and our reproductive function. So, and in real life, we're not doing option 1 or 2, we're doing option 3, which is 1 and 2 combined, obviously. So we're usually removing what we call paths or obstacles to cure, or obstacles to health. And so by removing those obstacles to health, we're trying to reduce the amount of damage, to the body, and B, we're trying to improve our capacity, our resistance to this kind of stress, this chemical stress, so we can support overall health. And it's important to mention, we're chatting about fertility here, but oxidative stress has a huge impact on neurological health, cardiovascular health, kidney function. So oxidative stress and the benefits of antioxidants and a healthier lifestyle go beyond, just IBS to fertility, heart health, brain health, etc. So it's an exciting avenue of research and avenue for patients to look at if this is something that may be beneficial for them to support them on their journey to health as well. And the particular cases we see, it's on their journey for conception and fertility. So it's a very important aspect of how our lifestyle, our diet, our digestive health can significantly impact outcomes with treatments like IVF or even trying naturally. So it's very important if you are trying to conceive, you're struggling to conceive, that we're not, just zooming in kind of with blinders on, okay, like what's happening in the ovary, what's happening in the uterus. We're also taking into account everything else that's happening in the body as well, and how it can impact function of the uterus, ovary, or the sperm function as well in many cases. So if this is something that you've been dealing with, you're trying to conceive, it's important to reach out to your healthcare provider or message us, send us an email or drop us a message here or a direct message, or schedule a consultation to talk about this in much more detail and see how this may be of benefit for you.